Insights from the world's best medical minds. You are watching therightdoctors.com.
Good evening, ladies and gentlemen. Today I am here, Dr. Naren Malhotra from Agra, Managing Director of Global Rainbow Healthcare, and I'm a gynecologist by profession and has been a president of many international and organizations and vice president of 2 international organizations. I'm a gynecologist who's been dealing with COVID pregnancy patients right from the first time COVID disease was detected in India. So today we are going to talk something about COVID updates and the second wave, how to be safe and how to prevent yourself from the third wave, and what to do about vaccinations. And if in pregnancy you get COVID, how to handle that. So pregnancy in COVID times has been a more difficult aspect today. And patients have been very worried. Doctors have been very worried. And we've been telling everyone to be doing meditation, yoga, walking, exercise, and relaxing to it. So it has been a challenge in pregnancy and also in delivery. And it is seen that about 10% of pregnant women will have COVID. Now in India, we get 80 million people getting pregnant in a year. So 10% is a huge number, and about 25 to 30 million deliveries occurring in India, which is a huge number. And so we are going to face a lot of brunt of pregnant women and pregnancy and delivery. 4% of all these women will be symptomatic and will have problems. In COVID, the risk is more because of the immunity and because of the changes which occur in pregnancy being a relatively immunosuppression stage. And then if both A and B of these, that means physiological changes and immunosuppression, and then you have some comorbidities like diabetes or other diseases, then you're more likely to get COVID infection than the general population. But maternal disease is not aggravated by pregnancy as per se, unless there are comorbidities. So we classify COVID disease in pregnancy as mild flu-like, and few severe, which is shortness of breath, respiratory rate is more than 30 per minute, and pneumonia has started. Critically ill, which may be immunocompromised patients and elderly patients who are more at risk, which have a hypoxia of SpO2 less than 93, and where their lung will show 50% damage. And most of the newer disease or this second wave has caused different symptoms like fatigue, malaise, and we'll be talking about this. So our first question to be answered, or the first aspect to be answered in this talk, is vaccination. Should pregnant women be vaccinated? Yes, pregnant women are a bulk of the population who are at risk. As I said, about 25-30 million deliveries occurring and about 80 million getting pregnant every year. So there are a huge number, and these need to be protected, because when you vaccinate a pregnant woman, you're saving 2 lives. So you're saving the fetus, because some of the antibodies are going to cross. And when the breastfeeding mothers get vaccination, the antibodies go to the breast milk and save the fetus. So we had our consensus meet, Federation of OBGYN Societies of India, that is FOXI, and 13 other international organizations and national organizations got together, made a white paper, talked to the government, argued with them about the safety of vaccinations. And then we had this, that allow vaccination for pregnancy and lactation. Now, based on all this and a huge advocacy which the gynecologists all over India did, and even international, the Indian government gave an advisory of allowing vaccination for lactating mothers, breastfeeding. For pregnancy, it is still not allowed, but will hopefully very soon, within a week, be allowed, because it is safe. Now it is proven to be safe. Now, what are the vaccines, you will be asking me? Well, India has 3 vaccines currently. The Covaxin, which is an Indian-made vaccine of the whole virus, which is put on a carrier adenovirus, and then the vaccine is made. And we have the non-replicating vector vaccines like the Oxford AstraZeneca, which is Covishield, and we have the Russian vaccine, Sputnik V. We don't have the Sputnik Light or the single dose right now. And we will very soon have the Johnson & Johnson vaccine and the Novavax vaccine. And hopefully we will also have the RNA vaccines, that is the Pfizer and Moderna of America, which are theoretically shown to have the best immunity. Now, obviously the question arises, we are being attacked by variants. And we have been attacked by British variant, South African variant, the Brazilian variant, the B1617, which variation was in India. And now we have a Vietnamese variant, and then we have the Delta variant, which are not, because they're very recent, after this study. So will the vaccines be effective against this? Now the vaccine makes a antibody against the virus. So if the virus changes its structure a little bit, most of the vaccines will work against the variants also. About the Delta variant, whether they'll work or not, is still the studies are going on, because that is the most dangerous variant which we have seen in the second wave, and which will probably be seen in the third wave also. So pregnancy, the fetus is high risk of delivering early. So most women, a lot of women will have preterm births, and the situation of delivery is going to be totally different. The monitoring is in isolation, the ultrasounds are in barriers, the doctors are all dressed up so you can't recognize them, and the babies are handled by overdressed, like in space suits. So this has got a new normal which has changed. And what we were thinking of making a labor and delivery like a pleasurable time for a woman is now converted into a stressful time because of all this precautions which we have to take. So antenatal visits, when the visit for pregnancy, usually women were coming every month and maybe even more, so 9 or 10. But today we have reduced or requested women to come only for 4 times. So for their blood test, for their ultrasound, and the next time for their next ultrasound and tetanus injections, and then for a growth scan, and then finally to assess things on delivery, and then they come in labor pains. And we are training them to monitor themselves at home. So they can count their fetal kick count and about the viability. They can take their pulse oximeter, pulse, weight, blood pressure, all that can be done at home. So home monitoring for normal women, but high-risk women still need to be monitored in the hospital. And when you come in the hospital, you will have to maintain social distancing, even in your counseling classes. You'll have to be properly masked, sanitized. As you can see, 2 people are here. One is sanitizing, one is taking temperature. And this will be what the scene will be in the hospitals. And then we'll take you stepwise, step 1, 2, 3, 4, on assessing, talking to you, talking to pregnant women, evaluating them, and if needed, the ultrasound guided procedures like amniocentesis I'm doing here would all be done with great precautions. So antenatal contact to be reduced, no extra tests to be done, regular testing, and done only when the patient visits. So combine all the testing visit and the ultrasound visit. The patient is very concerned. Now the patient gets concerned because she's asked to isolate herself. So someone in her family is sick or in her house is sick, she's locked up in a room. So that will give additional care to these patients are needed, ensure that she gets necessary counseling on video counseling, provide information of potential risk of adversity pregnancy, and advise the maternity team to be ready to handle with these patients, all psychological and physical and health needs. So how do we manage these patients when they come to us? Even for patients and for doctors, you may have asymptomatic women with no symptoms, and they've just tested positive because they had a sore throat. They can be managed at home. 10 days isolation is now recommended instead of 14. And you give them multivitamins, vitamin D and azithromycin, and some steam inhalations in general treatment, which we'll talk about. And they are based only when they are severe symptoms or they are in labor, then only, or there is a very critical illness and they need to go to ICU. So 3 types of patients will be admitted. Now in the hospital, the preparedness would be different. So what was usually all open and everyone walking in, now will be all sheltered. Your delivery and the rooms would be all curtained, and you'll be cordoned off, masked, and will have to wear plastic PPEs and things like that. So that makes it a little traumatic, the whole birth experience, which we actually wanted to be very pleasant. Because you see, you'll either see your nurses like this, or doctors like this, or like this in front of the operation theater, and you will not be able to recognize who's your primary treating doctor, because they all look alike. And sometimes they will have to hang or introduce themselves because they are doing. So for the maternity unit, what we do is we train all the staff and make them wear the proper PPE, and we minimize the staff which is going to handle COVID into isolation, and we conduct mock drills. Here we are conducting a mock drill against the various things. And you see that our labor rooms and our operation theaters have double filtration. So the air goes out from these filtrate, and HEPA filtered air comes in. And these, the rooms would be fogged. So labor room fogging is going on here to kill the virus. And then we leave an ultraviolet or an antiviral light on. And the hospital area is triaged. So you have the green zone where the patient first comes in, checked, and if suspected, put in the orange zone, and if they're proved to be COVID, they go into the red zone for management. So smaller hospitals are having difficulties in doing all this, triaging, because they need a huge area. But this is what is required. And then, of course, we will assess the severity. Majority of them have mild or moderate cold-like flu. Certain cases will have severe. Certain immunocompromised elderly pregnant women will have severe fatigue, diarrhea, everything. And there'll be some which are critically. And these patients will be monitored by what we call as a maternal early warning sign, that is MUSE, or by their systemic organ failure assessment, or SOFA. And these are for the doctors to do. So what do we do in maternal early warning sign is that, and sequential organ failure assessment. These need to be assessed, because then you need to know the severity of the disease, and you'll have to plan the delivery, whether it's going to be operative or whether we're going to let them deliver normally. So in the maternal early warning signs, we take the blood pressure, heart rate, respiratory rate, oxygen saturation, urine output, maternal agitation, confusion, unresponsiveness, and pregnancy-induced other diseases like preeclampsia or the others. In the quick sequential organ failure assessment, the blood pressure, the respiratory, the consciousness, all are taken. So let's see how it goes on. The patient comes to you and assessed, then we continue monitoring in admission, and then we do the things again on the mother, and if required, they go into ICU, and if they're deteriorating, then they go for immediate emergency cesarean section, because we don't want them to go into septic shock or acute organ failure, which might be difficult for them to recover in the mothers. What medicines we give? Yes, if they're not about to deliver, then aspirin and heparin would be started for you. Some anti-infective like antibiotics, which is the safest in pregnancy, is azithromycin. Or even if there is a signs of some shock, sepsis, then higher antipyretics would be given, and fetal screening and infection screening and all will be done. And of course, a lot of vitamins and hydration would be done. Fortunately, the transmission to the child is unlikely, and there is no evidence of virus seen in the cord blood of the fetus. None of the 48 babies delivered in this study showed any vertical transmission. So vertical transmission is rare. And in our own study, which has just been published, we also saw that 2 babies on the second day tested positive, but at birth they were negative. So probably it got later on, or it came later, not 2 days, 4 days later. So the mother has to monitor her own fetus. So she will see the fetal heart, small Doppler can be taken and put on the abdomen like this, and the heart rate comes. And they have to take their temperature, the movements, and all these signs. 95% of the babies born to infected mothers will be in good condition. So don't worry about that. Unless the damage has occurred inside and unexplained intrauterine fetal death has occurred, or abortion has occurred, which also could be possible because of a theoretical placental damage which occurs. After recovery, in pregnancy, in first trimester, second and third trimester, you will be treated like a normal patient, and you have to undergo the normal antenatal care. Now we have clear-cut Indian guidelines, ICMR guidelines, and when the patient to be admitted intensive care and what to do 24 weeks and 24 weeks, and if there is a severe failure criteria. So immediate operation has to be. So these are guidelines that are nice, clear-cut, and available. And the guidelines for negative patients, stop monitoring, positive patients, isolate at home. I'll call them only for ultrasound after they recover, isolation in home, critical self-monitoring, and persist on false negative. And if they are hospitalized, then the hospital monitoring for the mother and the fetus to be done. And depending on the stage of delivery, we can give steroids or give magnesium sulfate if we feel that the delivery has to be done within the 24 hours. So for fetal lung maturity and fetal neuroprotection or brain protection. So now let's come to the general things, how to fight the second wave. Now, second wave can be fought by controlling fever, doing proper testing, monitoring your SpO2, monitoring oxygen, taking oxygen therapy, getting the tests, not too much of testing, but at least D-dimer and CRP. CRP is the most important, and that should be less than 10 for all of you. Help the doctors fight this, take proper fluids and nutrition, isolate at home, do breathing exercise, and take proper whatever medicines is there. Please note the difference between various cough, cold. So if you have dry cough, achoo, sneezing, it is air pollution. And it happens only when you go out. If there is cough and sneeze and the nose is running and you get mucus in your cough, it is common cold. If you get cough, mucus, sneezing, runny nose, little body ache, slight fever, it is flu. And if it is dry cough, sneezing, severe body pain, weakness, high fever, difficulty in breathing, then it is coronavirus disease. So this we need to differentiate on our own and be safe on recognizing how the coronavirus disease is. Now, the old strain caused fever, loss of taste, and cough. The new strain has caused new things. Body aches, eye becomes red, sore throat, diarrhea, discoloration of your hands, nails become bluish, severe headaches, and respiratory rashes all over your body. So if these are happening, that means you are affected by the newer strain and the B617 or the Delta strain. Now, we must know everything about coronavirus. Fever, cough, shortness of breath. The virus spreads by droplet. When you're talking without a mask, it goes to about 8 feet and the others can catch it. And you should prevent by cleaning your hands. Do not touch your hands in your eyes and nose frequently. Wear a mask and avoid contact or touching sick people. Sanitize the surfaces, your table where you're working, if you're talking to people. And if your flu symptoms are worsening, not recovering, then visit your doctor immediately. So let's see the timeline. The day you catch the virus, which we cannot know when, is 0. You will get infection 5 days, symptoms 5 days. So if you get cough and cold now, you have caught the virus 5 days before. So try to think back, 5 days back, you met who all. And then the body fights this. So the body builds in antibodies. And the first antibodies will appear on 7 days, which is IgM. And they'll continue for the next 15 days or so. Then these antibodies, IgM, become permanent antibodies, which are IgG. And they start appearing in 14. And the test will come positive, can come positive up to 28 days, even after you have got cured. So after 28, so please do not get repeated RT-PCR done or repeated antigen test done. They can come positive up to 28 days. So the window period for only PCR positive is 0 to 7 days. Decline period is day 14 to day 21. It is now said day 10 to day 21. And the convalescence is up to 28, but you can be still infective in this period. So you have to keep isolated for at least 21 to 28 days. What everyone should have in their house: a pulse oximeter, a thermometer, a respiratory exerciser or medicated balloons, emergency Air 6 oxygen, hand ones, or some immunoboost sprays, a box of surgical masks or proper N95 mask, and some vitamin C, vitamin D tablets, a plastic gown, and we always tell them have some music, and meditation prayer books. Stay at home, stay safe. Now see, if you are not wearing a mask and you are a COVID carrier and the other is wearing a mask, the other can still get it 70%. If you are wearing a mask and you are the disease and the other is normal, only 5%. So the disease people have to wear a mask and carry it. But if both are wearing a mask, then the disease transmission is about only 1%. 101 will get the disease. So wearing a mask is the most important thing. For us, there are guidelines for using properly the mask, the healthcare workers, hygiene, open the mask nicely, put the nose over the bridge, don't touch the mask repeatedly because the virus could be there, it could come on your hand, and dispose of the mask from your ear and throw it away. And there are various types of masks. You do not need all type of masks. It is the N95 which filters, or a 5-layer cloth mask would be one of the best ones. Now, what if you have got vaccinated? So if you've got vaccinated and you're sitting with all the vaccinated people, 14 days after the second dose, you can interact without the restrictions. But you still need to wear a mask in public. If you are vaccinated and you're sitting with unvaccinated people, then you can infect them because you can be a carrier. So always wear a mask. And if unvaccinated and unvaccinated are sitting, then they have to follow all the COVID appropriate behaviors of sanitized, mask, social distance, and get vaccinated as soon as possible. So staying home with family is better than staying in the hospital alone. And please do not spit on the road, spit everywhere, have proper coughing, that means cough in your clothes, sneeze in your clothes, or in your handkerchief, or in the paper napkins and dispose them out properly. The risk increases if you cough and sneeze in public. So do not spit or cough in public. Try to be a responsible citizen. And do not go out unnecessarily. Exercise regularly, especially breathing. No over-exercising if you've got, and eat good protein-rich diet, green vegetables, vitamin supplementation, do steam inhalation. Steam inhalation does not kill the virus, but it opens up your systems. Add a little bit of eucalyptus oil in it or camphor in it, and take medications only on advice of the doctor. Please do not self-medicate yourself. And all your risk reduction can be done for slippers, gloves, clothes, washing hands, taking shower when you come home, and when you're staying at home, avoid crowding in a single room. Be aware, and those who have got disease and come back home, do not stigmatize them. They have got an infection. It could be you, so do not stigmatize. And then how you should disinfect your house. You can use ethanol, isopropyl, and all the disinfectant sprays which are available. As you can see, many sprays are available. And the surface should be sprayed regularly if you're talking or your computer or anything, and if people are handling it. So the spraying is very, very important. Check oxygen levels, again, very important. Now you see, if you put it in all 4 fingers, sometimes the value is different on all 4 fingers. So when you put the oximeter, just wait for a minute. And usually you put it in the middle finger, just wait for a minute and rest. And then you will get it, the correct. And when you get it, then take a 6-minute walk, what we call as a 6-minute test, and come back and take it again. And if it doesn't fall, that means you're doing very well. Then you should subscribe to a hospital isolation package from any of the hospital or the doctor. And home isolation experts are available in various packages, and this should be taken. And you should monitor, keep a COVID monitoring chart like this if you are suffering from the disease. Time, pulse, blood pressure, SpO2, temperature, 6-minute walk test, and any problem. Now this the government released in the newspapers on what treatment you can take. Ivermectin can be taken, doxycycline can be taken, but doxycycline not for pregnant women, ivermectin not for pregnant women. Vitamin C, vitamin zinc, B complex, vitamin D3, steam inhalation, breathing exercises, pranayam. For lactating mothers, no ivermectin and doxycycline, only azithromycin. For children, all these are available in syrups. So these are simple medicines which can be kept at home, and simple medicines will boost up your immunity, and that will kill the virus. We still don't have any very specific drugs against the virus. There are remdesivir, there is ZAMS, and there is a monoclonal antibodies. So we say isolate, take steam inhalation, take all the vitamins, take aspirin, take relaxation exercises, and this would be our typical in pregnancy for positive cases home isolation. The All India Institute of Medical Sciences, ICMR, in April 22, just 1 month back, gave us guidelines on how doctors should be managing mild, moderate, and severe disease, and what we should be doing. And we should all be following this, because this is evidence-based and this has been released by the Government of India. All precautions the doctors have to take, and you also have to take. All precautions, even when we are handling babies who have been born, because the liquor fluid might have some virus and that could be there. Usually it is not there. All precautions for your clothes and disposing of your clothes. Then if the pregnant woman is isolated and lonely at home, so we have an app which is called iMums app, which has been, which is recommended as a pregnancy companion. And this app, through this app, you can go through exercises, go through meditation, go through all the pregnancy behavior and all, and go through Garbh Sanskar, Garbh Samvad, things like that. So this app is one of the most wonderful things which has happened to India. This has been awarded as the Atmanirbhar second prize app by the Pradhan Mantri Narendra Modi, and this was done by my wife, Dr. Jaideep Malhotra, and her team from IIT professionals. So we have this app, iMums. Please note down and go and register on it. If you are very sick, you're hospitalized, most of them will get well. Here are two very happy faces. This one is still on BiPAP and is recovering. This one is recovered and ready to go home after delivery. So, ladies and gentlemen, the take-home points are: pregnant women should follow the same recommendation. Antenatal care should be done through teleconference in pregnancy. And if the symptoms are increasing, please go to the hospital. So together, you and me will beat this virus. We just have to take general measures to enhance our body's natural defense mechanism. We have to eat right and eat at right time. We have to stay at home, exercise, read, on touch online, enjoy bonding with family, video call your friends. We have to take care of our mental health, especially for pregnant women. We have to have faith in God and do some real meditation. We have time when we are locked in to let your hobbies grow and do something constructive. And we have to build zones of safety around us, the green zone and the yellow zone and the outer environment zone. To do gardening, be at peace, do meditation, do yoga, do everything. And do not go away from the red fear zone into the green zone, where you think about helping others find a purpose to your life. So Corona might be winning just now, but we, in this fight against Corona, we are definitely going to win very soon, very, very sure of this. You can also take some of these pregnancy care books which we have come out with, which are priced at 125 rupees and 500, the detailed ones, a pregnancy survival manual, and the number is here. And you can note down the number and make your order and get these books. So, ladies and gentlemen, thank you for attending this. We will now take all the questions. I'm surprised that there's so many questions, almost 50 questions I can see. But be a COVID warrior and pray to God that Ishwar sabki raksha kare. So we will now switch off from the presentation and take your questions. And these questions which have come to me, I will go ahead and read them one by one. A lot of them have been repeated, so would have a similar answer. So what are the options for a pregnant woman who wishes to get vaccinated against COVID? The Indian options right now is Covaxin, Covishield, and Sputnik. All three, anyone can be taken by a pregnant woman as soon as it is allowed by the government. Right now, as of today, 4:30 p.m., just now 4:50 p.m. Vaccination for pregnant women is not allowed. It is allowed for lactating women, those who are breastfeeding. What are the benefits for vaccinating pregnant women against COVID-19? There are lots and lots of benefits. We will be preventing a huge population which is at an additional risk of falling very sick. And we will be, by vaccinating pregnant women, we will be saving 2 lives. So that is the major benefit. What are the risks of taking COVID? There are no risk of taking COVID vaccine in pregnancy. You will get the same small, mild side effects of pain and slight fever. So no risk, no risk. What people say, clotting will happen, it doesn't happen. It is very, 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 very rare. Will vaccination be available? Yes, vaccination will be available for all pregnant women very, very soon. And there are no contraindications in pregnancy, no contraindication, except for very severely sick patients who have a lot of blood clots and all. Maybe there we can give in hospital. There has been trials for vaccination in America, and various trials have been published, and because it is not a live vaccine. Once it is not a live vaccine, it will not cause the disease to the pregnant woman, and it will just develop antibodies after a local reaction. And these antibodies will cross through the placenta and help your baby also. So now the vaccine has ingredients, either a protein, spike protein, or it is a full vaccine, full virus, or it is an adenovirus carrier vaccine, all dead. So there are parts, we can make vaccine through parts of virus or through the whole virus. And none of them, because they're all dead particles, none of them are harmful in pregnancy, none of them. Since there are multiple vaccines available, best choice is whatever you get. There are 3 vaccines available in India. I'm telling you again, Covaxin, Covishield, and Sputnik. Whichever you are getting, take it. All 3 are good to be taken in pregnancy. So we have no choice of Pfizer or Moderna yet. When they come, we will see of taking them as a booster later on. But right now, take whichever vaccine is available immediately. Stage of pregnancy, well, it was first said that don't give anything in the first 3 months, the first trimester. But since this is a dead vaccine, it can be given in the first trimester also. But still, a lot of people are going to give it in second and third. So yes, give it after 12 weeks of pregnancy, no problem with that. That's a personal decision. But it is as safe. What precautions after vaccination? No special precautions. You might get a little bit of body ache or pain on your shoulder or a little bit of fever. Just take paracetamol for it, and that's it. Now, should a woman who had her first dose before pregnancy take the second? Now, if a woman has taken the first dose and she got pregnant, currently the government of India does not allow the second dose in pregnancy. So till it is not allowed, she will not take the second dose in pregnancy and take it after delivery. But we are foreseeing that within next 10 to 15 days, vaccination will be allowed in pregnancy and the second dose can be taken in pregnancy. The Joint Committee on Vaccination, the JCVI, has advised individuals below 40 not to take Covishield. Now, this is not right. What Covishield showed was in 10,000 plus or some cases causing a little bit of clotting. And this clotting could affect your heart or your brain. Now, this is very, very rare and a very, very rare side effect. So we should not be at this thing. Those patients who are at risk of clotting, they can probably go for the other vaccine. Is it necessary for a pregnant woman to undergo any medical test before vaccination? No. You can get an antibody testing done to see whether you got COVID or not and what are your COVID antibodies present in you or not. And it is not necessary to do an RT-PCR or things like that. But yes, initially we could do a test to see if you are negative at that time of vaccination. So you're not suffering from the disease. If you're suffering from the disease, then defer vaccination for 2 months or 3 months after getting RT-PCR negative. So can Newborns be protected? Yes, newborns can be protected when the mother takes these vaccines. Viral vector vaccines like Covishield, Covaxin, all will produce antibodies against the spike protein, and some of these antibodies will cross the placenta and go to the baby and protect the baby also. Is it possible to judge how effective the vaccine is against B1617 variant? Now, most of these have been shown to be effective a little bit, about 60% against this variant, but less effective against the Delta variant. So we are now more worried about the Delta variant. But these vaccinations have shown protection against variants also. Not that much, but have. Which vaccine would we recommend for Delta variant? We still are not very sure. Tests and trials are going on. Right now, you please take whatever vaccine is available. It will prevent you from normal corona and many other variants, and probably to some extent against the Delta variant also. Guidelines for the Central of Diseases Prevention said fully vaccinated all social activity. Now, America has allowed that. When you're fully vaccinated with Pfizer or Moderna, they have allowed you to move around in public without mask and take full. I personally, and a lot of people in India and a lot of scientists, even America, feel that's a wrong step because the virus is mutating. And if the virus mutates so fast and makes another variant which can attack the vaccinated people, then it will be a very difficult time. 40% of British population is immunized, vaccinated. But we are, yes, today only we are seeing that the cases are rising in Great Britain, in the United Kingdom, in London. So we still should be following COVID appropriate behavior. That is my personal opinion and an opinion of many, many other COVID scientists and doctors. Can lactating women? Yes, lactating women can take the vaccine. It is allowed 24 hours after your birth till 1 year of breastfeeding. You can take it anytime. So if you're breastfeeding, please take it because the antibodies will go to the baby also and prevent the baby. So the infant, the next question says, will the infant be protected? Infants do get protected with the breast milk on a fully vaccinated post-delivery patient. According to CDC, pregnant women are more likely to develop respiratory complications requiring intensive care. So yes, pregnant women, because I told you, because of immunocompromisation, because of comorbid conditions, because of other things, are likely to get seriously ill, though the number is less. So that it is very, very important for us to vaccinate these women and to protect them. And this in India, the figure is almost 50-60 million pregnant women. What precautions a treating gynecologist must take on delivering? Precautions are for the treating gynecologist is first teleconferencing. Second, have a barrier, proper N95 mask, proper PPE in your OPD, and talking at a distance, doing all the procedures, taking double precautions for the patient and yourself. And when you're operating or delivering a patient, a full PPE, waterproof PPE, should be personal protective equipment with eyes being covered nicely with goggles, face shield should be taken properly. And your labor room should be properly sanitized, should be a separate labor room for COVID patients. And the distance for the neonatal resuscitation tray should be at least 2 meters from where you deliver. So if your resuscitation trolley for the neonates inside the labor room, just take it outside the door and the baby has to be moved there. And then, of course, assessing the pregnant woman by Muse criteria and SOFA. Muse is maternal early warning signs, and SOFA is systemic sequential organ failure assessment. So to know the severity of the disease. Are there any additional precautions for a pregnant woman? Yes. Mild pregnant woman should isolate for 10 days and do only teleconferencing and come only when required. When they come to the hospital, come in your own car. Don't take a public transport. And come with proper appointment so you don't have to wait. And come only when you are called for your ultrasound or your blood drawing test. So those, and of course, wear a mask properly and a face shield properly. Does vaccine have any impact on fertility? No. Vaccine will not infect fertility and sexual life of men and women both, which is a big myth for which people are not taking vaccination. You take measles vaccine, you take mumps vaccine in your childhood. This is the same vaccine. This is just similar. And you take all sorts of vaccine for all diseases. So why are you getting worried about this? Should a woman who is fully vaccinated wishes to become pregnant delay a decision? No. Women can get vaccinated and take that decision of going ahead with the pregnancy. Yes. So there is no need for special delay of your pregnancy treatment, IVF or IUIs, or your natural planning. So as opposed to the guidelines from the Central Diseases of Prevention, social distancing aren't required post-vaccination. Absolutely, it is still required. COVID appropriate behavior, even after vaccination, is required unless 60 to 70% of population is immunized, which has not happened yet in any other state except Israel. Israel has managed to vaccinate almost 80% of the population. So they've opened up normally. But they should also be careful because a variant can still attack them. What about the third wave? Yes, the third wave is going to come. In United Kingdom, 40% fully vaccinated. The third wave has started appearing from today. So be careful. In India, the difference between the first and the second wave were 32 weeks. So the second wave is gone, or just going. So 32 weeks from now, we can expect the third wave in September or in October. So be prepared, be careful, stay at home, do all the masking, sanitization. Do not get rid of your mask and get yourself vaccinated as soon as possible. There seems to be some immunity against the virus. If once infected, how long will it last? Well, yes, when you get the infection, you develop T-cell immunity, IgG in your body, and you can get it tested, so you know how much immunity is. And when you get your vaccination, you get anti-spike antibodies, and the minimum value should be 250 or above. Most of us, like me, I got infection after vaccination, very mild, asymptomatic or slight symptoms. My immunity has come out to be over 2,500. How long will it last? I got vaccinated in January. It has lasted till now, till June. So we know till 6 months it is lasting. How many more months the immunity will last? That only testing will tell. But we estimate that it should last for 1 year at least. And we will need, all of us will need a booster dose of vaccination after 1 year. And that time, all types of vaccine will be available and you can choose whatever you want. Right now, take whatever you are getting. As a gynecologist, what would be the general advice to the gynecologists who are seeing large? Well, my advice to my fellow gynecologists is a lot of healthcare workers have lost their lives. A lot of them were not vaccinated for reasons unknown to me. Why would you not get vaccinated when it was being given to all the doctors first? So get yourself vaccinated first. Do teleconferencing. Put a shield in front in your OPD. Wear your mask properly. Clip over the nose nicely and airtight. Wear a shield over it and avoid touching everything. And if you touch, then immediately sanitize your hands and keep your room open, even with the AC on, so that the air circulates. And what is believed that this virus lasts in the air for sometimes does not happen to you in our rooms. What precautions should a COVID woman take after delivery to ensure? Well, if she is seriously ill, we will isolate the baby from her for 10 to 14 days till she gets okay. If she's moderately ill, we can or sitting down and walking around, then she can be given the baby to feed. with a proper screen and turn her face other side and keep the baby to the breast. And similarly, the other side and breastfeed. So shielding of the mother and the baby, breastfeeding is allowed, but if very seriously ill, then the babies are isolated from the mother for 14 to 20 days, 21 days or 28 days, depending on how seriously ill she is. Researchers have shown that COVID cannot pass from infected mother to the child. So COVID antigen will not go through the breast milk or through the blood. But when you're breathing over the child and talking, ayo, my son, my beta, have some milk, then the droplets are going and it's going through the nose. So yes, it doesn't go through the breast milk, but it can go through the droplet transmission. That is very important. 90 days wait if the test was positive before receiving the vaccine. So if you get the disease, you will develop antibodies. And these antibodies will last for 3 months at least. So your vaccination should be deferred by 3 months. It's so simple. You can take it at 2 months, but you can even defer to 3 months, 90 days. A pregnant woman has received her first shot, but test positive for the virus. How long should we wait for the test to be? Now, if you got the first shot and then you get the disease, 14 days will be your disease, and then wait for another 14 days to 1 month, or maybe 2 months maximum till you get the second dose. So defer the second dose till you are absolutely all right for 40 days, because your disease has also developed antibodies. Is there a possibility of third wave in India? Yes, we heard it from the experts. We had a program with Naresh Trehan, Dr. Handa, and everyone that the third wave is coming. And the first and second wave came after 32 weeks. So it's 32 weeks from today, ladies and gentlemen, where we should be very, very careful, very, very careful. Follow all COVID appropriate behaviors. Please wear masks, please sanitize, please get vaccinated, and please do not social distancing, physical distancing, but social connection. So connect with friends on video calls, keep physically distance from it. If both of you are vaccinated, then maybe you can meet. But don't go out in public, don't go out in malls, don't go out in crowded areas. So if the pregnant woman contacts COVID in the third trimester as opposed to first and second, so third trimester, she's about to deliver. Now, in third trimester, disease sometimes gets very severe. And if it gets severe, we might have to deliver immediately because it's causing unexplained fetal deaths. So delivery, she'll be prepared for delivery at 36 weeks or 37 weeks and not go up to 40 weeks. So we could be there and she should be hospitalized, yes. Our miscarriage and stillbirths, we are seeing a little bit more incidence of miscarriages and stillbirths in COVID positive patients. The reasons could be many, could be the disease in the mother's system, which is causing them, could be placental blockage of spiral arteries, could be placental clots, but the virus itself is not directly killing the baby inside. ICMR guidelines for management of COVID patients in pandemic says obstetric management should not be delayed for the test. Yes. So if the patient has come to you in labor and she's about to deliver in 3 hours, you're not going to wait for a COVID RT-PCR to, when it comes negative, then only I'll deliver. Delivery will happen. So we take this patient as potentially COVID positive and deliver her with the appropriate COVID precautions, which I've just shown you in the COVID labor room with all the precautions. And if her test comes negative, fine, she goes shifts from the red triage area to the normal green area or the normal ward. So we need to deliver. Then obstetrics cannot be delayed just because the report has not come, because the delivery is going to occur. Would you advise a woman who has high risk pregnancy to get vaccinated? Absolutely, yes. Women who've gone through pregnancies after ART, who are elderly, who are having some diseases like diabetes, blood pressure, and other diseases are the first who should get vaccinated. because if they get the disease, it will be very severe in them. So we need to vaccinate them very, very first. Are lactating mothers or recently pregnant mothers at a higher risk of developing serious? Well, the risk is almost the same unless these women have comorbidities or unless the viral load is very, very severe. Are certain age groups more likely to develop serious? Now, older age group is more likely to get non-vaccinated. This time in the second wave, we saw the younger people got more serious. And these are those who did not get vaccinated and those who in a younger age have developed diabetes, blood pressure, heart disease, and the other diseases. So they got very sick. That is what happened in these days for this. So this age group of older and younger. The third wave, they are saying that children will get more infected. Why? Because most of us would be vaccinated by them. So this virus has nowhere else to go except in children. So it will go in children and infect them. So which is a possibility. But because children do not have the ACE receptors in their nostril, so the virus cannot multiply very soon. Children, if they get disease, will get a very mild disease. If they get, let's hope so. And let's pray for the same and keep our children safe. How many times must a pregnant woman who's asymptomatic, positive for pregnancy, visit her gynecologist? We just said 4 times. If in Corona times, all of them, but if required, you can visit even more frequently, of course. What if she develops symptoms? If she develops symptoms and they're mild, home isolation treatment on video conferencing for 14 days, and then she can come and visit and get the rest tested. Will pregnant women need to be mandatorily tested for COVID-19 before delivery or any scan? See, ideally, they should. And many hospitals, even us, are following that anything which any patients who we operate on or do a procedure should be tested because they could be asymptomatic carriers and they will spread the disease to all our operation theater, to all the patients who are non-infected and to the doctors and to the nurses and to the OT assistants and all. So they should be tested before delivery is what I feel should be there. Will vaccinated women require testing for COVID? No. So if once they are vaccinated fully and they've taken COVID procedures and they have no signs, then we need not do the testing. Maybe if we feel they're carriers, yes, but I don't think so. Low levels of vitamin D have shown to have more complications. Yes, that is why in the treatment, high doses of vitamin D were shown to be helpful, and vitamin D level as it is should be kept normal for all of us. We Indians face a unique thing. We have so much sun, but we still are vitamin D deficient. Why? Because we don't go out at the time when the vitamin D synthesis occurs. Vitamin D synthesis occurs in our skin when we go out in the sun in between 11 a.m. to 12 p.m. That time we are all in the offices working and a lot of sarees and see all full sleeve shirts and pants. So we are all covered. So we have to go bare upper part and legs into sunlight to develop vitamin D from the sun, which is very, very abundant in India. And of course, the color of our skin being brownish and darkish, we are less. So we all should be taking vitamin D supplementation in general life also. And if there is COVID, then a little bit more exposure to take one. All pregnant women are advised 2,000 units of vitamin D every day in pregnancy. Previously, it was 60,000 units per week, but now it is shown that a daily dose of vitamin D taken by pregnant women is much better in preventing pregnancy complications like blood pressure, IUGR, pregnancy-induced hypertension, and pregnancy growth retardation, all that things. So it prevents that. Now, one group of experts suggests that if the mother has COVID-19, it may be helpful to leave the vernix for 24 hours after birth, as it contains antimicrobial system. So what is vernix? Vernix, when the baby is born, it is born with a small white covering, which is like a a butter-like covering all over the skin, and we clean it nicely. And this baby lives inside the womb in amniotic fluid. Amniotic fluid or liquor is supposed to be antimicrobial, and it fights infection. That's why the babies are all protected. Now, leaving the vernix over the skin is, I have not read this and I have not had a personal experience, but personally, I would feel that it is better to have a clean, nice baby rather than leaving that vernix and the flakes over all the body. So I don't think personally I share this view. If there are studies and if it is in literature, if it is proven to be good, so why not? We can leave it for 24 hours. It's no big deal also. If a pregnant woman has COVID-19, what changes should she expect from a normal delivery? No changes. If she is mild or asymptomatic, she will have the same normal delivery. Only if she is very sick and her SOFA score is getting disturbed, that means sequential organ failure has started occurring, then she has to be delivered emergency by a cesarean section. We have seen that cesarean sections rate have increased in COVID patients. Yes, because probably of a scare of the patient and of the healthcare workers. But if they're delivering normally, normal delivery for asymptomatic or mildly symptomatic is absolutely not contraindicated and same risk. Some studies have shown that SARS-CoV-2 virus has been found in sperm in men. So does this affect fertilization? See, now this virus, when it goes into your body, it will go everywhere. Finally, it'll end up going everywhere, even in your tears and things like that. So if in 1,000 cases, one man sperms have shown a few viruses, it's no big deal. Sexual intercourse is not a way of transmission of this virus. This is a droplet infection. It transmits only through droplet, and it attacks the nose nasal mucosa, which has the ACE2 receptors. And you see those spikes behind, those spikes in the viruses behind my head, they will attack this ACE receptors, and that is kill it, and they enter into the cell. And so I don't think they will be able to enter through any other way. So I don't think fertilization would be effective. Still, studies are coming in. Maybe I'm proven wrong. Maybe I'm proving right. That time will tell. And the last question, ladies and gentlemen, is studies have shown that SARS-CoV-2 virus may impact male hormones necessary for normal sperm production and have a temporary effect or long-term effect and will need medical. I very categorically told you 2 questions earlier. This virus has no effect on sexuality and fertility. No effect. As of now, it's been only about since last March, 1 year and about 14, 15 months, this virus has been with us. If there are going to be any very long-term effects, we will know as the time turns. As of now, your sex life will not be disturbed, your fertilization will be not disturbed, and your hormones, sex hormones will not be disturbed. So please don't worry. Just be safe. Just be safe. So that was all the questions which came to us. Thank you very much for asking so many questions. I have tried to explain to you how COVID is affecting us currently and what we should be doing to prevent ourselves from getting infected by the third wave, which will be coming in September, October. So thank you very much. Thank you, Right Doctors. Thank you for hosting me on this wonderful YouTube live program on COVID in pregnancy. Thank you.
Insights from the world's best medical minds. You are watching therightdoctors.com.